Good morning, everyone. I'm Maria Juliet, a senior in the Nichols Dietetics program, and today I'll be talking to you about non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, better known as NAFDL, is becoming the leading cause of end-stage liver disease and liver transplant. The purpose of the liver is to excrete bile and to keep blood chemical levels under control. So we'll start out with pathophysiology of the liver. Majority of patients with NAFDL are obese, and it is because of the imbalance between high energy intake and the energy expenditure. Polycystic ovarian syndrome, better known as PCOS, type 2 diabetes, and alcoholism are all conditions associated with NAFDL. Nutrition, hormones, insulin, inflammation, genetics, and all play a role in NAFDL patients. Here we have a healthy liver and we have a fatty liver. There's a major difference. You see the fat on the liver versus the healthy liver. Now we'll talk about the client history. My client, Kim Young, is 38 years old and he's a Korean male. He's married with 3 kids and he works as an automotive manufacturer and is a supervisor. On some days he worked from 3 to 11 p.m. at night, and other days he worked from 7 a.m. until 3 p.m. Outside of work, he usually have drinks with his friends while watching sports. That's the most thing he does, but he drinks occasionally. Mr. Kim came in because he had a physical at work, and the test results came back that he had abnormal blood levels and an enlarged liver. His mother has diabetes. His father has hypertension and coronary artery disease, which is plaque buildup in the arteries that supply blood. He has hyperlipidemia and hyperglycemia. Hyperlipidemia is just high levels of fat in the blood. Food and nutrition related history. He isn't having any problems with his appetite and no problems chewing or swallowing. He enjoys eating fruits, vegetables, rice, and noodles. Sometimes he reports to have a sweet tooth and buys cookies out of the vending machine and even donuts. His wife prepares his meals at night, his dinner, and he prepares breakfast and lunch. Usually for breakfast he'd have coffee with milk and sugar, and lunch he'll have either burgers or sandwiches, chips or fries, a slice of pie, cookies, and a soda. The soda he chooses is orange Fanta or Coke. When his wife prepares his meals, she usually cooks a little healthy with meat, 1 or 2 cups of short grain rice, vegetables, kimchi, and usually some type of fruit. He also snacks throughout the day, and he eats a bedtime snack, which is chips, cookies, or popcorn, sometimes all 3. Data, medical tests, and procedures were done. His glucose levels were high, and in order to this is a sign that they can be developing type 2 diabetes. And in order to prevent or aid in the prevention of type 2 diabetes, a Mediterranean diet can help that. Both the ALT and AST levels were high. This indicates liver damage from hepatitis, liver infection, liver diseases. And in order to help with that, he can exercise and increase folic acid intake. Cholesterol levels were also high. HDL, which is considered the good cholesterol, was low, while VLDL and LDL were both high. LDL is a risk for heart disease, could raise risk for heart disease. And to avoid this, you could eliminate trans fats and reduce saturated fats in his diet. Triglyceride means that the fats in the blood was really high. Anthropometric measurements. He's 5'8" and he weighs 205 pounds with a BMI of 31.2, which indicates that he's obese. His usual body weight is 205 pounds, but his ideal body weight is 150 pounds. He has a blood pressure of 142/86, pulse of 77, respiration rate of 12, and a temperature of 98.7 degrees Fahrenheit. Nutrition focused physical findings. Everything was normal except for his abdomen with a firm liver and prominent to the left lobe, plus spleen tip with no masses or tenderness. So my PES statement for Mr. Kim was excessive fat intake related to undesirable food choices as evidenced by BMI of 31.2, fatty liver, and usual dietary intake consisting of foods high in fat, like the donuts and things like that. So. And my second PES statement was excessive energy intake related to food choices as evidenced by usual dietary intake. So my nutrition prescription to him is a Mediterranean diet. I chose this diet because it's low in fat that will help with his cholesterol levels, and it consists of like a lot of seafood and poultry in consideration, like moderate, with a lot of whole fruits and vegetables, and daily physical activity. Nutrition intervention. His nutrition intervention is to promote, the ultimate goal is to promote food choices that facilitate a reduced energy intake with the goal of reducing body weight. So the way we would reduce his body weight is by eating healthier and increase physical activity. When I say eating healthier, I'm talking about lean meats and fish and other proteins that are low in fat. Avoid processed carbohydrates and simple sugars. Increase vegetable, fruits, and whole grain intake. Avoid foods with high fructose syrup, corn syrup, and work towards a healthy weight. Monitor and evaluation. We will monitor this by when he comes back for his checkup that his patient labs are good and he has weight loss, getting back into his BMI into the normal range, and to check the change in his eating habits. The good thing about Mr. Kim is that he was willing to change his eating habits so that he can become healthier. Nutrition care manual. So about the Mediterranean diet. The diet emphasizes healthy fats such as olives and olive oil, avocados, nuts, and seeds. The primary source of protein in the diet is seafood, like I mentioned before, and nuts. Every day, eat a variety of fresh fruits and vegetables in a variety of colors. So I feel like Mr. Kim wouldn't have a problem with that because he mentioned that his wife prepares his meals and he eats whatever she cooks. To choose whole grains for at least half of your day's grain servings, such as whole wheat, brown rice, barley, cornmeal, oats, and to read labels to make sure all of them are 100% grain. And this is my word excited. Thank you for listening. Have a great day.